Is the scene safe? BSI. We have one male, unknown magnitude of injury. We received a call from dispatch saying unconscious male, unknown cause. We're going to call ALS backup, and then we're going to immediately come and take C-spine. Firefighter Fred, can you take C-spine? Thank you. Sir, can you hear me? Can you hear me? Patient's unconscious. General impression is we have one male, unconscious, unknown cause. We take our flashlight pen, and we're going to inspect the airway. The airway is clear and patent. Next, we're going to inspect breathing by listening and feeling. We see adequate chest rise and fall, so we can assume adequate ventilation. We have the patient on 15 liters of oxygen via non-rebreather mask. We're going to crank the tank up to 15 liters per minute. Next, we're going to check circulation via the radial and carotid artery. Pulse is equal, normal, and present. Next, we're going to take the back of our hand and assess the skin. The skin is pink, warm, and dry. We're going to take our scissors. We're going to get the patient trauma naked. Now, the patient's trauma naked, we're going to do a blood sweep with our hands, check for any potential bleeding. Reaching into the posterior area so we can see as much of the patient as possible. The patient has no apparent bleeding. We're going to manage him for shock, leaving him in the supine position and getting a blanket on him to manage his temperature. At this point, the patient's unconscious. We're going to call him a load and go. Has anybody seen the patient? Does anybody know what happened to the patient? Without anybody around, we're going to go right into our secondary session. First, we're going to take vital signs. Blood pressure is 122/70. We're going to check pulse and respirations. BP 60, strong quality. Ventilation 16 breaths per minute, adequate quality. Next, we're going to check for any deformities, contusions, abrasions, punctures, burns, lacerations, tenderness, or swelling. We're going to start with the head and feeling the spatial bones. We're also going to take our flashlight pen and inspect for any neurological damage via the eyes, looking for any cerebral spinal fluid in his ears, which is all clear. We're going to continue checking the back of his neck for step off, which is clear and not present. We're checking for he has no jugular vein distension, his trachea is aligned, he has no subcutaneous emphysema. We're now going to check for lung sounds. We're starting all four corners, starting high above the chest, and then high and tight in the armpits. His lung sounds are clear and present. We're going to continue palpating for any DCAT, BTLS. Making sure his ribs are stable. He has no tenderness, rigidity, or swelling of his abdomen. His pelvis is clear. His groin looks good. We're now checking the legs and lower extremities, which are all clear. We're going to check PMS in all four extremities, starting with the pedal pulse. Pulse is normal and present. Sir, can you wiggle your toes? Which foot am I touching? Which foot am I touching? The patient's still unresponsive. We're going to check his upper extremities. Pulse is equal, normal, present. Sir, can you wiggle your fingers? Can you wiggle your fingers? Which hand am I touching? Which hand am I touching? The patient's still unresponsive. On the head's count, we're going to roll him onto the posterior. Let's check for DCAT, BTLS on that side. 1, 2, 3. Log roll the patient. Now checking for any DCAT, BTLS, spinal alignment. Continuing with DCAT, BTLS, which is all clear. On the head's count, we're going to roll the patient back onto a backboard. 1, 2, 3. Log roll the patient back. We're going to strap him onto the backboard, reassess PMS, reassess his vitals every 5 minutes. We're going to recheck any interventions, including oxygen and shock management, and get him to the hospital.